Okay, so I don't think I need to do much of an introduction this morning other than it sounds like a wonderful topic of nutrition and mental health, two things that are very important at this time. So I'll let you rock and roll, brother. I'm going to disappear here, and I'll see you in a bit. Bye for now.
Cool, thanks. So yeah, today we wanted to dive into nutrition and mental health. It is actually the Canadian Mental Health Association's Mental Health Week here in Canada, so I thought what a timely thing to dive into. Last week we touched a little bit on gut health and how it can affect our mood, in neurotransmitter production. So this is kind of an extension on that one because I had a few questions that came in afterwards that were just asking to dive into it a little bit deeper and some of the specifics around how your gut can influence your mood and how you feel. So there's quite a bit, obviously just the gut, the overall health of it itself, specific vitamins and minerals that can affect our mood and neurotransmitters, and then also I call it like mechanical issues, constipation or diarrhea, certain things with our digestion that can really affect how we're feeling. So we're going to dive into some of those. I'm going to start leading off with the bowel movements, actually, just go right for it. If you think about it, these are a couple of things that can really affect how you're feeling. I'm sure everybody has experience being a little backed up, being constipated, and if things aren't moving smoothly, we're grouchy, we're irritable, we're not happy. We might have a little bit of bloating, constipation. There can be pain with these bowel movements. So if our digestion isn't functioning properly and we don't have good, smooth, efficient bowel movements, we're not happy individuals. On the flip side of that, diarrhea is another one. Once again, if that is happening or going to the washroom 10, 15, 20 times a day, there might be a little bit of anxiety around that. There can be pain with that. Oftentimes there's inflammation. So either one of those can really affect how we're feeling. So if either of those are happening to you, it's really important to get down to the root of why that's happening. With constipation, I really urge people don't just pop laxatives day by day. We really don't want to just be doing that. We can actually start to influence the bowel and have an atonic bowel, or a bowel that just doesn't actually function properly without a laxative. So you really want to try to make sure, if you are constipated, why are you constipated? Is it food sensitivities? Is there a bacterial overgrowth, some kind of an infection? What's going on in there that's preventing your stools from moving? If you have diarrhea, same thing. Really got to get to the bottom of why that's happening. Don't just be chugging Pepto-Bismol and taking fiber bulk supplements to help your stools out. Try to get to the bottom of why that's going on, okay? Secondly, we touched on this last week, but your gut bacteria diversity is a huge role player when it comes to your mental health and how you're feeling. This is kind of a new and exciting field, and people are starting to understand which strains of bacteria actually play a role in how we're feeling. And so some research came out in the last couple of years. It noticed two specific types of bacteria that actually create neurotransmitters in our gut, and it influences the levels of them in our brain. And they also help to make something called butyrate, which is an anti-inflammatory agent in our gut. It helps to give our enterocytes energy. It helps keep them healthy, essentially. So we've actually found specific strains and types of bacteria that can influence the overall health and inflammation in our gut, as well as the neurotransmitters that go from the gut and have an influence on the brain. So two pretty big, important things. When it comes to this, talked about it last week, probiotic can help with, probiotics. You really want to make sure you're taking the correct strains and the correct type of probiotic, so that's something to keep in mind. And you really want to make sure that you're eating, diverse types of fiber, so really trying to get 40 different types of whole grains, fruits, veggies, legumes in throughout the week. The more diverse our fiber sources are, the more diverse our microbiota are going to be, and the healthier off our gut's going to be. So super important there. Interestingly, when it comes to our microbiome, there's actually been some research trials done with FMT, or fecal microbiota transplants, basically a poop transplant, where they're taking the fecum from a healthy person who has tested to be like a normal gut bacteria and has a high quality of life, no anxiety, depression, that kind of stuff, and doing transplants with those for people who seem to have an unhealthy microbiome and who may suffer from depression, anxiety, and mental health issues. So the FMT originally, it was just for specific types of gut infections, but they're looking at branching out and trying it for all sorts of different things. So there's a ton of research that needs to be done before that's commonplace and happening day to day. But it's interesting to think that that's kind of the route that we're taking. When it comes to specific vitamins and minerals for mood, there are a few that I really like to focus on. We could go, into 20 or 30 different vitamins and minerals that play a role, but I really just want to hit on some of the big ones that I find people might be deficient in and that can really have the largest role to play when it comes to mental health. So starting with fats. Good, healthy fats, and that really means omega-3s, and that means EPA and DHA. If you ever looked on the back of a bottle of your omega-3 supplements, there should usually be both EPA and DHA. Some are EPA specific, some are DHA specific, but these are the two fats that really, really can help mental health. So EPA, it's primarily known, and I'm going to oversimplify this, both EPA and DHA have a lot of different roles in the body, so just bear with this oversimplification, but EPA is predominantly used for its anti-inflammatory purposes. It helps to maintain a good, healthy cardiovascular system, and if we don't have a good, healthy cardiovascular system, we don't have good blood flow to the brain, and that's going to be reduced brain health. So that's something that's super important. DHA, the other omega-3 that's important, it is the primary fat that makes up our brain. So it actually helps to create neurons and cells in the brain, so we need sufficient amounts of DHA. It's super critical in infants, children, and kids that are growing, so we need to make sure that we've got good amounts of DHA both in pregnant women and in little kids. DHA is absolutely crucial. So for nerve cell structure and function, we need DHA. For inflammation, getting good blood flow to the brain, we need EPA. So I usually just get people to look for a good quality fish oil or algae-based oil that's high in both EPA and DHA. In terms of foods that you can look for these, nuts, seeds, avocados, those are some of the big ones I go for. A lot of people eat cold water fish as well. Living here in Victoria, a lot of people eat salmon, great source of both EPA and DHA. So that. Second nutrient that I think is super important for brain health is B12. So this is something that you'll hear about often in the vegetarian and vegan community, but it is a huge deal when it comes to neurological function, especially in elderly. So B12 is important for something called myelination, which is wrapping a protective sheath around our neurons. Our neurons can't fire efficient and proper signals unless they have that myelinated sheath. So B12 is critical for actually allowing your nerves to conduct signaling back and forth throughout your body and within your brain. So B12, mostly you find it in, predominantly it's found in animal products. There's a few interesting veggie sources that have come up lately, but animal products are the big places that you can get B12, or in fortified grain, cereals, soy milks, and other plant milks. I recommend most people just take a B12 supplement. You can get lozenges, you can get sprays, you can get little capsules. It's a super easy one to take just to make sure that our levels are sufficient. And for anybody over the age of 50, B12 becomes more and more difficult to actually absorb just because of poor gut health, lower stomach acid, something called intrinsic factor, which is crucial for actually binding to B12 and helping them to absorb it. It just becomes more difficult. So for most people over the age of 50, I recommend just taking a B12 supplement to make sure that your bases are covered. So third nutrient is vitamin D. I imagine most people living in Victoria, Vancouver, and on the west coast of North America are aware of the importance of vitamin D. Maybe we've all heard of seasonal affective disorder, getting like the winter blues, and that's something that happens oftentimes because of low vitamin D status. So vitamin D, it's well known for helping to have strong bones or giving your immune system a little bit of a boost. It's an important inflammatory modulator as well. But when it comes to actually, feeling low and feeling a little bit depressed, it's strongly linked to having low vitamin D levels. So vitamin D, I recommend most people throughout the winter just supplement with vitamin D. It is found in animal products, eggs, different types of meats, mushrooms as well. But the best way to get your vitamin D is just by going outside and getting some sun when we can. We've had a beautiful string of days right now, and the more you can get outside to build your vitamin D status up, the better off you are going to be. Sad lamps in the winter work nicely as well. If you haven't seen those, they're called like a sunbox, or sad lamp is really the most common term for them. And if you can get 15 to 20 minutes of having direct light on your face every single day, that's a great way to build up your vitamin D as well. So the last one that I want to talk about is water. And while we may not think of water as a specific nutrient, vitamin, mineral, it's crucial when it comes to mental health that we actually do stay hydrated. Our brains are roughly 75 to 80% water. So think about it. If we don't have proper hydration, status, how is our brain going to function properly? We absolutely need that. For most people, that looks like about 2 to 3 liters a day. If you are an athlete, or if you live somewhere extremely humid and you're sweating a lot, maybe it is up from that. I know when we were traveling around Southeast Asia, I was probably drinking like 4 or 5 liters a day because I was just sweating nonstop. So you really have to work hard to get proper water intake in there. I know it's difficult for a lot of people, and they say that the more water I drink, the more that I'm going to the washroom. And there is a bit of an adjustment period when you start increasing your water intake, but it is just so crucial to everything. In clinic, oftentimes we see people with, we see a lot of pain, a lot of chronic pain. That can be a dehydration issue as well. Our joints need water to function. Our muscles need water to function. Everything requires water. So the more you can drink, the better off you're going to be in so many different ways. There's lots of other important things that are needed to be addressed when it comes to mental health, like physical activity, community, companionship, loved ones, or pets even. There's cool research showing that even having dogs decreases rates of depression and anxiety, which I think is so neat. Having goals, setting goals and conquering them, it's a huge one for feelings of well-being. Meditation and mindfulness is another one. And Dr. Marissa has done a wonderful job at developing MindFit at Backfit, so go check out some of the videos her and Dr. Doyle have been doing lately if you want some tips on mindfulness and decreasing some of that stress. And of course, there's mentioning that there is also clinical routes that we can go, both counseling and pharmaceuticals. So both have their time and their place. And I really want to put a little bit of emphasis on counseling during this week. You know, I think there's still, weirdly enough, that stigma about reaching out, talking to people, and finding someone to share how you're feeling and looking for advice or some kind of counseling. It can be through a loved one, a family member, a friend, or there's fantastic counseling resources right here on the island and throughout Canada, really. So it can make a huge difference in people's lives. So I really can't recommend that one enough. If you've never gone to a counselor or talked to somebody about how you're feeling, if you're having any kind of struggles with depression or anxiety, that can be such a difference maker. So just something to consider. To summarize, so that was a bit of a quick one today, but I'm just going to go through some of the bigger points that I mentioned there. Number one, our bowel movements can have a huge effect on how we're feeling, whether that is constipation, diarrhea, bloating, gas, or otherwise. Our microbiome, too, is a huge contributing factor, both in terms of neurotransmitter production and also being linked to stress or anxiety, depression from certain strains. Number three, we're looking at specific fats, EPA and DHA. We want to make sure we're getting adequate amounts in our diet. 4 is vitamin B12, super critical for nerve conduction. Vitamin D is our 5th, so make sure we have adequate amounts either through sunlight or through supplementation or through having one of those sad lamps. And lastly, just reiterating the fact that it is Mental Health Week here in Canada, and if you do need any resources or you're looking for anybody to talk to, shoot me a message and I'm happy to send you some information or set you up with somebody who might be able to help. My email is drmorton@backfit.ca, and if you need anything at all, just reach out and I'd be happy to send you in the right direction. Okay. Have a great day. Have a wonderful rest of your week, and we will see you guys on Friday, I believe. Take care.